You look fascinating. Would you mind talking to us for a few minutes?
Oh, sure. Absolutely. What's up?
So, tell us about yourself.
Tell us about my work. So I'm a cardiovascular researcher and also founder of VeganMed, as I was saying. I think the fun part to mention here is there's a condition out there. It's not so fun, but it's called alpha-gal syndrome, where a tick can bite you and you can't eat red meat anymore. And actually there's three ticks now: the Lone Star tick, the deer tick or the black-legged tick, and the western black-legged tick. And they're there for a good chunk of the United States, where about 500,000 people now have this condition called alpha-gal syndrome. What happens when you get bit by this tick? You have this delayed reaction, an IgE-mediated reaction, and you can break up into hives, anaphylaxis, anytime you have exposure to red meat or products that have mammalian-derived products in there, like medications. Since we're at ACC, I should probably mention that medications would be important. So medications that have gelatin in them, magnesium stearate, polysorbate 80, drugs that are made using biologics, Chinese hamster ovary cell lines. So all of these medications can be a problem. So 75% of medications have animal-derived ingredients in them. So, a patient would not know which statin to take. So that's the problem that we are blessed to be solving. A patient can come to us, a provider can come to us, and we can tell them which medication will not give them this anaphylactic reaction. Because heparin will, some of the anticoagulants will, some of the statins will, and others won't. So
This is fascinating, and every time I see you, I learn something new. Why should we care about this as clinicians?
You should care about it because we don't want our patients ending up in the hospital. And there's a correlation between alpha-gal syndrome and cardiovascular disease as well, increased risk of atherosclerotic disease. But we should care about it because we don't want them to have anaphylaxis reactions. 50% of these patients are having anaphylactic reactions because of medications. 92% have had to change their medications because they don't know what to take, and they possibly have animal-derived ingredients in them. And unfortunately, the CDC said only 5% of providers across the country feel comfortable enough managing this condition. So there's more awareness needed. So I'm glad you tapped me on my shoulder and are asking about it. And this is important.
I love that you're bringing awareness to a super important topic that affects a pretty big chunk of the population, right? And so how do we as clinicians treat our patients differently? How do we find access to medications where those components are not present?
Yeah, so veganmed.org is a free service where I encourage providers to reach out, use our chat feature, and just ask which drugs do you want a response to. Patients are right now reaching out to us. Last year we helped 6,000 people and about 150,000 people on our website. So it's a free service, and we want hospitals to partner with us. We want pharmacies to partner with us, and providers as well.
I think this is a brilliant thing that you've created to help a lot of people. I do also have a question about you as a person.
Sure.
So what energizes you to show up and do this work? You're an innovator, you're a thought leader, you're a researcher, you've created a company. Like, what makes you want to show up to do this work every day?
Oh, wow. Now you're getting into the deep-rooted questions. The short answer would be, we live in a world of iPhones and iPads. For me, it's just, I care. I just care about patients, and that's the right thing to do, to do the best that we can for them.
That is the most beautiful answer. And what is one thing that you do for fun that other people wouldn't necessarily know about you?
This is not fun, but it's fun. I read Facebook comments from patients who have alpha-gal syndrome so I can understand them better. So it's a little fun, but it's also educational at the same time, because many conditions start as patient advocacy groups like alpha-gal syndrome, and also long COVID and many others. The patients were talking about it. In women's health, INOCA and ANOCA, that was patients recognizing it, and then we got to understand it. So I try and engage with the patient on social media to see what's going on.
I think this is such a valuable perspective, even for me coming from like the clinical medicine side of things. I think just knowing like patients will oftentimes tell you what's going on with them, and we really should have that openness and awareness to say, hey, if you're telling me something is abnormal or wrong, there is something going on. And so it's amazing you take it to the next level where you truly want to understand, engage, and almost like take it to the psychology level of like what's going on for these people.
Yeah, no, it's the whole patient that we need to take care of.
Yeah.
Body, mind, medicine, all of it comes together.
Concur. One of my smartest friends. Thank you so much for doing
that. Thank you so
Yes,
much.
you
You're
are.
awesome.